Thank you all. Good afternoon. Sorry, first of all, to disturb your endocrine system. And this is what actually infectious disease do. And this is what COVID did. We were just doing our routine work. And then COVID-19 came to the picture and disturbed the whole system. And this is what I'm doing here. I'm just disturbing your endocrine system lectures. So just bear with me. And sorry for doing that. The talk today will be like chat. It won't be a new thing for most of you. It is something everybody lived it, knew it, but we will try to highlight some points from public health point of view. This is a kind of public health in action. This is what public health do in action, and COVID-19 was a good example of what we do during such a situation. This is the contents, brief introduction, prevention of communicable disease. We'll try to finish as much as we can. I'm starting with the definition of public health, just to highlight one word. It is not only a science, it is the science and art of promoting health, preventing disease, and prolonging life. And the word art here is very important because it is not only a science. We depend on science, but you need a lot of art to deal with the community problems, community health problems. And this is what the whole world did during the pandemic, including, of course, Bahrain. So there is COVID-19, Corona, is under the umbrella of what we call emerging and re-emerging diseases. Let me start with this graph. This graph shows the mortality in the United States, the whole mortality. This is the black line, and you can see that there is the reduction in mortality since the 1900s up till the 1980s. These are the causes, the blue line because of non-communicable disease, and the red line because of non-communicable disease. And as you can see clearly that there is a reduction in the mortality related to infectious disease in general. So at that time, somebody came in the 1960s, one of the scholars in the medical literature, and he said, well, because of that, we think that infectious disease will be defeated. It will be no more there, and we will be free from infectious diseases. Well, somebody else came and had this closer look at the last part here. As you can see, yes, infectious disease were decreasing as a cause of mortality. But since the 1980s, it started to increase, as you can see here. So actually what happened, yes, there is a general overall decrease, but we saw an increase in infectious disease mortality since the 1980s. And this is because of what now known as emerging and re-emerging diseases. And emerging means the new diseases like Ebola, Zika, of course, COVID-19, SARS. And as you can see from this graph, it is all over the world. It is everywhere, and it is a risk for everybody on the continent, on the globe. So it is here, here, there, here, everywhere. And unfortunately, yes, it started, the SARS started in one part of the world. As we know by now, it was everywhere very soon after that. This is the Minister of Health in the States, and this is something we need to keep in mind. Actually, when we are in a relaxed situation, we thought that whatever we do before a pandemic will seem alarmist, but actually everything we do after will seem inadequate. And this is what we see now. Even after all what we had experienced, we start to hear Well, are we really doing this for a good reason? Well, last year, we had a lot of deaths during Delta wave. And we saw the deaths, we saw the losses of lives that take place in this country and or in the world. So this is something we need to keep in mind. We need to be prepared. And this is what everybody needs to understand and consider while we are preparing for whatever next pandemic. Hopefully it will not happen, but we know that it will happen. This is our beloved coronavirus. Will not go through this. I know everybody knows that. But just to show you that corona is not a new one. It has his friends, brothers and sisters, MERS-CoV, SARS-CoV. It comes from the beta coronavirus genus. So we knew something about him, if we will consider him as the virus. This is schematic of the virus. I'll not go through it again. Now, we will talk about the epidemiology, the epidemiological care, some basic concepts that we all heard during the pandemic. To start with, there are certain outbreak patterns. There are common source outbreaks, like for instance, in food outbreak. This is a common source. Propagated source, like COVID-19, infectious disease, person to person. And there is a point source. Why I'm bringing this? Because there are different types of cares for each one. If you are dealing with a common source, then you will have this or this, depending. Point source, you will have this kind of care. If you will have a propagated kind of outbreak, then you will have this kind of, you will expect to have this kind of outbreak. So from the beginning, we knew something about the virus. We knew that it is a person to person. So we knew that we will have such a care, which all with its all characteristics. And we have also some other things that we already know. Infectious disease, especially this type, the virus is ahead from us at least by 2 to 3 weeks. This is an early curve of the China cases. As you can see, here they announced in late 2019, 31st of December. Here they announced the first case, but actually, the cases started early, at least early at that month, 2 to 3 weeks earlier. And as you can see, this is the peak of the symptoms started, and this is the peak of the identification of cases. So even with the symptoms, we are at least 2 weeks late than the virus itself. So the virus, and when we want to deal with it, we are, he or the virus, it is ahead from us at least by 2 to 3 weeks. Well, there was a hashtag, a famous one, flatten the curve. And everybody was talking about flattening the curve at that time. And it became like a common knowledge for everybody. And that was interesting thing. But for me, as in this field, I was thinking, well, we need to clarify to people, even our colleagues in the healthcare worker, that flattening the curve does not mean eradicating the virus. We were trying to buy ourselves time. We want to push this curve from starting here to start there. So we'll have more time here to prepare our health system to deal with the virus. And we were trying also to decrease the amount from there to here, so we can also prepare ourselves as a health system to deal with the situation. So flattening the curve was not the aim to eradicate the outbreak or the pandemic. We were trying to buy ourselves time and be ready for the surge of cases that was expected to come. And this is very important because a lot, even healthcare workers, even colleagues, they thought that flattening the curve means ending the pandemic. It was not aimed to do that. This is the today's actually situation. One point to see, as you can see, this is the number of cases in the world, and this is the curve here of deaths. As you can see, these are the delta wave, alpha and delta waves, and you can see the peak of deaths here. It was very high at that time. Though the Omicron now, the Omicron variant is taking the scene, and it is much higher, 3 times at least higher than the Delta wave at that time, but the death rate is much lower, at least even lower than the Delta wave. This one, this is indication of that the Omicron, for a reason or another, is milder as a severity. A similar situation in Bahrain. This is very familiar one. The same situation, as you can see, this is the death rate during the Delta wave when we had it last year, and these are the number of deaths during the Omicron. Though we have a very high number of cases, at least 2 to 3 times the number of cases that we had during the Delta, but fortunately we had very few number of cases of deaths and even ICU admissions during the Omicron outbreak. This is the same thing by month. This is the same thing, but distributed by nationality, Bahraini and non-Bahraini. And why we are doing that? You can see it is started, I don't know that it's clear from there, but we had the first wave or the increase in the number early in 2020, in April 2020, then we had it again, an increase in September, August, September, October in 2020, and early 2021, January, and of course we have the peak last year in May and till almost July. As you can see, the green line is the total for both Bahraini and non-Bahraini. The red line is for Bahraini, the blue line is for non-Bahraini. We will take the closer look. Okay. This is a closer look of the early wave. As you can see earlier, we had the first case was Bahraini, but then we had the first increase among non-Bahrainis. Here in March 2020, we had, and why? Because it was spread among the households or the places where they are living, while Bahrainis were not that much. But since starting from Ramadan that time, Bahrainis start to increase, and after Ramadan, they were taking the picture, while non-Bahrainis continue to have the same level. Actually, they started to decrease. While we had this peak among Bahrainis, which was coincide with Ashura at 2020. Why we wanted to classify the cases among Bahrainis or non-Bahrainis. This is a very clear indication on that the dynamic of infection transmission was different between the two populations. And this has an impact on what can we do to prevent the spread of the disease. So at that time, we were concentrating, at this time, we were concentrating the action on non-Bahrainis. Here we need to concentrate all our actions towards Bahrainis. So what actions were taken? I think, yes. All the actions that have been taken were based on this triangle. There is, as we know, there is kind of equilibrium between infectious agent, the virus, environment, and host. And these are the factors: infectivity, pathogenicity, virulence, the host, age, sex, all of these things. All the actions, and this is very basic, and even in internal medicine and medicine, I remember one of our tutors telling us, if you want to treat the most complicated cases, you need to have your anatomy, physiology, pathophysiology very clear in your mind before embarking on doing anything. So this is what we do also in public health. You need to have your basic knowledge about how the dynamic of infection is taking place. And this is very important because we know there are certain characteristics of the host, certain characteristics of the infectious agent, and the environment that we need to take care of. We knew something about the infection. This is another basic thing. We know about the transmission, dynamic of disease, how it is infected, the infection transmitted, latent period, infectious period, course, and incubation period, and symptomatic period. So from the beginning, we knew that this virus is transmitted by direct person to person. And that's why we have these preventive measures. So this is something based on what information from the beginning that we knew. This is a coronavirus. This is a person-to-person kind of transmission. There is a possibility that it is an droplets, most probably, with airborne probability. That's why all the preventive measures that were suggested based on the limited information that we had at that time. Of course, there are a lot of scientific literature supporting whatever actions or preventive measure that we suggested. We, the medical literature suggested. And this is what we keep saying. Very simple, but very effective, because this is how the virus can be prevented at that time before the vaccination were available. Another thing, and another thing that were very useful, though we were stating what is allowed and what is not allowed, but at the end of the day, we use the laws to enforce the action. And this is very important. And fortunately, we had our public health law which was issued in 2018. The masking, now face mask is kind of standard. Earlier in the pandemic, there were a lot of talks about it. Is it beneficial? Is it not? And even the WHO at the beginning stated that no, it was not useful to prevent the disease. But even before the scientific evidence, that's why I said you need to think and use the art, the definition of public health. Even before the solid scientific evidence stated very clearly that mask is beneficial, the public health personnel, the medical personnel stated that no, you need to use your mask. And by now, we know that it prevents the transmission of the disease, especially if those who are wearing it is the effective one. This is what WHO want us to do at that time, and we did. Every country, all the countries did. Isolate the suspected case, test them. If they are positive, then you need, of course, to treat them. And if you need to do the contact tracing. And this is what Bahrain did. I will not go in details. You know, the testing centers, commission center, drive-through, mobile unit, all of these things. A lot of preparation, because we managed to flattening the curve earlier. We managed to make ourselves ready and prepare the field hospitals, the خلص الوقت. Okay.
1 more minute, please.
1 more minute will, okay. Okay, I'll skip this, skip this, skip this, skip this. Okay. I think there are a lot of lessons to learn from whatever happened. And the main thing are that basic knowledge and approach are very important. We need to keep our basic knowledge in our mind while we are dealing with whatever problem, including, of course, even dealing with individual patients. Use the available scientific knowledge to design control measures. And this is what we know. We knew from the beginning the method of the transmission, very basic virology about the virus itself. Involve all the community. Of course, you know, and this is what I was explaining, know your community. And that's why we need our local expertise. Dynamic of infection, we know because we know our community. There are different dynamic of infection. That's why we managed to deal with these differences. Risk communication, be transparent, scientific, up to date. If the mask was not scientifically known to be protective at that time, we need to tell people that. We need to tell the people about the vaccination efficacy and all of this information. Volunteers did a huge difference to the whatever we did during the pandemic. Leadership, I cannot say more about leadership. Everybody knows that because of the high commitments from the higher authorities in Bahrain, we managed to had this success